Hi, I'm Beatrice Seguin, PhD. What used to be that time of the month is now this time of the month. Welcome to our community, a curated space for everyone going through perimenopause and menopause. A place where we can find support, good laughs, great tips on products, and lots of education on health. There's beauty in aging. Whatever beautiful means to you, this time of the month will help you find it and live it. The content expressed in this time of the month is not intended to be a substitute for medical advice. The views and opinions expressed on this show are those of the speakers. Today, on the couch at TTOM, we have my brother, Mil Seguin. And the reason he's here is because he's going through a really interesting journey that I think is worth sharing with our community. You are an educator. You've had 20 years experience of working with diverse learners and at-risk youth, but your journey, your own journey, is why we're here today.
Yeah, well, part of my place, how I fit into this project, this journey, this idea that social construct is a little weird sometimes, because it's often seen as kind of something that destroys culture or society instead of adding to it. We're often seen, or should I start with saying?
Yeah, let's tell the audience.
I'm sorry, I have a tendency to go way ahead of where I am. I was born, I was assigned female at birth, and for most of my life, you've known me as your sister. And I know it's sometimes a little weird, and I think in a certain way, I'll always be your little sister. I think that, there's things that can't really disappear. But my journey has been a weird one throughout time, because since I was very young, I think we could tell that something was different from how I was evolving. Mm-hmm. And not just socially, also physically, biologically. As a child, it wasn't just what I liked to play, who I liked to play with. It was really how my body was developing as a young child, pre-puberty. And then eventually, after many years of difficulty that, we'll be able to discuss about with the health system, with society, with how I perceive myself, I eventually realized that I'm trans, I'm transgender. I am, as we could say, transmasc and not a trans man. I'm not a trans man because I do not wish to be necessarily perceived as a man or walk life as a cis man. But I'm definitely not a cis woman. So I walk this line that is kind of a non-binary, non-gender conforming line, which can be fluid, but also means I think it'll take a long time before I find what or who I am exactly.
The reason I wanted you to come on this show was because of my own menopause journey. I am cis woman and feeling invisible. And in that journey, I went to a medical conference to learn more about menopause management, women's health. And it was a 4-day conference. And of those 4 days, there was only one talk, but at least there was one talk, so progress. The topic was about patients assigned female at birth transitioning on hormone therapy. And it was a moment for me as your sibling. It was a realization for society. If we feel invisible, I cannot imagine what it must feel like for my sibling. And that's why I wanted you on this show, because I want to make sure that when we talk about menopause, we are talking about everyone going through perimenopause and menopause. So do you want to tell us about a little bit, like, what would that even
It's hard to imagine.
look like? Mm-hmm.
It's very hard to imagine, because I feel like they say that menopause is centered around the experiences of general cis women. So it's very hard to see yourself as somebody who will go through menopause when you don't see yourself as a woman and you don't see yourself aging as a woman. And that's what we've been taught when we were young. Right now, you will have a period and one day you'll stop. One day you will go through a change where you will grow old and you will suddenly become, not to use words that are triggering for people, but sort of empty or incapable of producing life. Like somehow we are no longer capable of having that spark or that energy. So in my head, never living my life, like later on as a woman, I wouldn't necessarily, how would I start with that? I have a uterus. I would like to have it out, but I have one. And regardless of my gender identity, that's a reality that I will have to go through symptoms from hormonal changes, my body aging, which is beautiful. And it's a different cycle. It's a lot of mystery.
What's it like to navigate a healthcare system
It's hard.
for you?
It's very hard.
Are there specialists who can work with you?
There are specialists. They are far or few. I find that most of the healthcare professionals I have met that have been somewhat well-versed in trans care or gender-affirming care have been people that have learned kind of by themselves, that they were medical professionals or are medical professionals, and they found an interest, maybe because of a member of a family is going through something similar, or maybe because it's a place they feel that there is not enough work having been done. And thankfully they're there, and we really appreciate it. But it's really more elective than anything else. And that means there's not enough education and there's not enough knowledge. So
maybe
it's difficult.
learning together with their patient?
Well, that would mean having be listened to, which can be very hard in our healthcare system. The more we go into the different intersections of minorities, the more we kind of sort of are unheard or unseen or not believed. Because what we are going through, if it is believed, it invalidates what we are saying, because we're saying it in a moment that is not supposed to be the most stable for us for hormonal reasons, biological reasons, but we just sort of disappear.
Are there resources
Yes.
that you'd want to share maybe with some of our viewers, either to learn, to support members of our community, or someone searching for resources?
Well, we're definitely going to be able to give a whole bunch of links, a whole bunch of different places you can call to, people you can talk to. But what I found that is most important, because I've tried to reach out to certain resources, and I don't want to say they don't exist, and I don't want to say they're not good. It's just that in my own life, as a woman, I had resources and I felt like they weren't for me. As a trans, masc, non-binary person, it's the same thing. I feel like most of the services that are there, the resources, somehow I feel, oh, but other people need them more. Or so I'll be very honest with you. I know a lot of them. I've used very little. I teach about them, but I haven't used them. So I feel like to point them out and say you could do this, this, and that, I almost feel like I'm being disingenuous about my own wellness when I feel like I don't even take care of what I need. So I wouldn't know what to tell you really about the resources people can go through when it comes to their own health. But for others, I would say meet people, go out, go on forums, get a Discord, just do something, because the more you meet people and the more you meet people like you, that's when you're going to start finding the resources you need.
That's good advice. I sense a little bit of mistrust of the system. Is that fair?
It's very fair.
Do you want to touch upon that a little bit, especially in the context of, your whole life transition and
Well, I happen to have a few different diagnoses that make it that my health journey has not been very usual. I have Crohn's disease. I've been operated on when I was quite young. I have fibromyalgia. I also have different mental health diagnoses as well. So my mistrust of the health system starts very young. And I think that where we can sort of find commonality here is it started as a young woman, because I remember going to the doctor with our mother, and she always believed us. She always believed me, but we would go to the doctor and I would be told, you're a young woman, this is normal, you'll get used to it. It's your reproductive system, it's this or it's that, but there was always something that was blamed onto the fact that I was a growing woman. And one day I will figure it out. Turns out I had Crohn's disease. I had 20 centimeters taken out by emergency out of my bowels. Like, it was bad. But for years, nobody listened to me and nobody listened to my pain. So my mistrust started very early on.
Do you think there is a cultural element too? I mean, our mom is an amazing person. She's always listened to us. But do you think there's a cultural element to the deferring to the establishment?
Yes, because especially our mother, coming from a war-torn country that has been going through colonialism, imperialist feudalism, and governments that do not let people speak. And when they do, as we know very well, they get swept up. We have an aunt that disappeared in El Salvador when she tried to speak up. We have members of the family that, it's a thing where she comes from a generation and she comes from a background that you have to trust the professionals. But that erases our voice in all of that. I think that a holistic approach centered around the patient, regardless of whether they're male or female or whether they identify in or out of that, I think that's what's needed. What does the patient need? And then all the professionals should be around, because then transition wouldn't even be a thing, because you're the patient and you have all the different professionals around you. So you wouldn't have to take your dossier and then go see another doctor and have them read it for you.
And then explain everything.
Exactly. And they don't listen to what we're saying necessarily. And I don't want to say it's all the medical professionals. If I'm here today, it's because some of them listened and some of them were there. And some of them prescribed me what nobody else wanted to. Which, by the way, was for reasons of cultural heritage as well. I was told by a doctor that they wouldn't prescribe me painkillers because my demographic was too risky for addiction and overdose. So my pain was automatically minimized simply because of my cultural background.
So you had to do a lot of self-advocacy,
Yes.
which is another point of commonality. I mean, constant advocacy for yourself. Can we touch upon the fact that in navigating the healthcare system, you still have a uterus? Would that mean gynecological exams?
Yes.
Okay, and can we go there for a second? Because I think it's an uncomfortable experience
For anybody.
And we had an interesting conversation about that in terms of, do we think everyone goes?
They don't.
Yeah.
They don't. I know a lot of people with uteruses or that would need a gynecological exam that have never gone, and they're 30, they're 35, and they're not a special case. This is happening more and more, unless there is a medical problem or something that pushes them to see. They won't go.
It's almost as if the healthcare system, I like to think of, it's like a disease. It's a disease system versus health wellness system.
Absolutely. Well, there's this expression that says that the healthcare system is for the healthy. And that when you're sick, well, that's a problem, because it doesn't go into like, you go here, you go there, everything rolls well. When you go see a doctor, you get some pills, you get better, it's good. But when suddenly we start having different conditions, different things that will not be resolved and aren't necessarily, they're not ending your life. You can still have a great life, even though you may have different conditions that just need to be treated. But they just shouldn't be seen as a burden. And I find that often, if we have something that needs more care than an immediate treatment, we're seen as burdens, as something that will have to keep on being taken care of.
That's intense.
Yeah.
But important. That's why we're here. We're not going to solve everything on one conversation on a couch, but if I can learn with kindness from you, because there's so much I still have to learn, I appreciate that, and I hope that the viewers as well can understand. We can learn and we can teach with kindness.
Absolutely. If I may, I find that one of the biggest problems we have right now is that we can't talk to each other.
Yeah.
Because we're afraid to disagree, but we're supposed to disagree. If everybody agreed, we wouldn't get to anything. We wouldn't create. We wouldn't evolve. We need to discuss. There are certain topics that are off the table completely for people, that the moment you speak about them, there is anger and there's resentment, and it's because we just keep on piling it in. If somebody misgenders me by mistake, it's okay. It happens. If somebody misgenders me continuously on purpose, that's violence. That is something that is targeted. So we just have to learn that it's not because somebody says something that automatically we need to silence the person or we need to change the way we're thinking. We need to have the discourse. We need to feel comfortable in speaking to each other, and we need to forgive. And we need to understand that we don't know what we don't know. The moment we know it, well, then we can work on becoming better people. But if we do not know it, it's not an excuse. We can't say, I didn't know it, so I am not connected to everything else that I benefit from today with my own different privileges. But if we simply do not know it, we can't do anything about it. So if we talk, we educate with kindness, with love, with respect for people, then we might go somewhere.
We might go somewhere. So why don't we, it's philosophical. There's a lot of deep stuff. So maybe the Proust questionnaire that we like asking some of our guests or all of our guests. We'll ask some questions. Okay, get your perspective. What if you could change one thing about your family? What would it be?
One thing about my family?
Yeah.
Wow.
I'm your family. I'm not the only family you have.
No, you're not. I'm somebody, and I think a lot of queer people have the same thing. We've built our own family a long time ago. Like, our chosen family is very strong in our lives. Our community is not just community. It is people that we really see as members of our everyday support that permit us to have a tomorrow. That said, I've chosen to keep the ones in my life that were already family by blood, and I've chosen to add some regardless of blood, including my daughter, that I did not feel the need to be related to genetically and who I raise as my own. Yet I recognize her differences and I recognize where she comes from. And when I look at her, it's okay that I don't see myself because she's her own person. But you make your own family, and that includes our ancestors. That includes the people that have come before us and where they've brought us, and the people generations from now that are going to come from who we are. So that's kind of what I do with my family. And that includes all the animals.
Yes, our wonderful pets. What's your idea of perfect happiness?
It's one of those things where I don't want people to go like, oh, like, poor you. No pain. Pain makes everything up. Physical pain. It can just be really, really hard psychologically eventually, you know? There's just a time eventually where you just kind of have to live with a constant hurt that just sort of triggers a lot of other things. And happiness can be many things for me. And it can be love, and it can be intimacy, and it can be listening and being seen. But I think perfect happiness can be found in the lack of pain. But then again, that could mean when you're soothed by a loved one, when you're with people that you appreciate. Those are all moments where pain disappears, right? So pure happiness can happen at any moment that you feel like your body can sort of relax.
Last one. What is your favorite journey?
The journey to myself? It's a hard one. But I think it's I think when you find your way and you start sort of seeing where you're at. Even if you're in the middle of the desert, it doesn't matter because you know where you're going. So I would say my best journey is towards myself.
And I think that is very relatable. If you want everyone here to just go home or turn the podcast off with one take home, what would it be?
We exist. We're in cracks, and we don't look like we're there, but we exist. And when I say we, I want to speak, if I may, in the name of a lot of people that simply don't recognize themselves in these models that have been created. And that includes people of color not seeing themselves in medical models every day they go to the hospital. That includes trans women that feel like they're left out of the conversation of menopause, even though they will live with fluctuating hormones and will live with symptoms resembling menopause. And I want this, with all of its inclusivity and its mainstream, because it has to be, because the majority of people are in certain areas, and we need to get that information out there. But it is that we exist and we are as important as everybody else. Because most of what we live today has been kind of constructed around and upon us. It hasn't been life all the time, and it won't always be either. People menstruate, whether they be seen or perceive themselves as male or female. People can have children, people can not have children, and it doesn't make them any less male or female or human. That's it.
Yeah. I see you.
I know, and I appreciate it.
I ask every guest this last question. What makes you feel beautiful?
Looking in the mirror and recognizing myself. Because for almost 4 decades, I didn't know who was there. And it's hard to find yourself beautiful when you don't even know who you are.
Thank you for coming today and having this conversation with us.
Thank you for having me.
It's summertime, so I figured I would cover something that I absolutely love. It happens to be a Central Ontario brand called Livin Lake Simcoe. And what I love about what I'm wearing, this Turkish bathrobe, is what happens when Canada and Europe have a baby. So this is made of sustainable Turkish cotton. It's absolutely wonderful texture, and it's a 3-in-1. I'm wearing it today, as you can see, as basically an outfit. And especially around lakes, cottage country, vacation, it just feels fabulous. But I can also wear it with my bathing suit by the pool or the ocean. And finally, you can definitely wear it just as a regular bathrobe in your bathroom. So what a wonderful way to make your dollars stretch. It feels luxurious, and so don't forget to check out Livin Lake Simcoe.